What role do prognostic factors play in osteosarcoma personalized medicine? Imagine a world where cancer treatment is no longer a one-size-fits-all approach, but instead tailored to each person's unique tumor. That's the promise of personalized medicine, especially in complex diseases like osteosarcoma. Osteosarcoma is a rare but aggressive bone cancer that mostly affects children and young adults. Despite advances in treatment, outcomes remain challenging, especially for those with recurrent or advanced disease. This is where prognostic factors come into play. They are characteristics that help doctors predict how the disease might progress and how a patient might respond to different treatments. These factors are essential in guiding personalized approaches to care. Traditionally, doctors looked at simple features like the tumor size, location, and whether it had spread at diagnosis. They also considered the patient's age and how well the tumor responded to initial chemotherapy. These factors helped estimate prognosis but didn't tell the whole story. With new molecular technologies, researchers now analyze the genetic makeup, protein patterns, and immune environment of each tumor. This detailed information reveals specific gene mutations and biological pathways that influence how aggressive the tumor is and whether it might resist treatment. For example, alterations in genes like TP53, which is known as the guardian of the genome, can make tumors more aggressive or resistant to therapy. Changes in pathways involving HIF1 alpha or MYC can also signal a more dangerous tumor. These molecular features serve as new prognostic factors, providing a more precise way to predict outcomes and choose targeted therapies. If a tumor shows overactivity in certain pathways, doctors might consider drugs that specifically inhibit those pathways. Similarly, immune system signatures could suggest whether a patient might benefit from immunotherapy, which is a treatment that helps the immune system fight cancer. The goal of using these prognostic factors is to match each patient with the most effective treatment based on their tumor's unique biology. Instead of giving everyone the same standard therapy, clinicians can tailor treatments to target specific vulnerabilities. For instance, if a tumor has high activity in the CDK4/6 pathway, drugs that block this pathway might be considered. This approach is especially helpful for patients whose tumors do not respond well to standard treatments, opening up possibilities for experimental therapies that could be more effective. However, applying these molecular prognostic factors in everyday clinical practice is not without challenges. Osteosarcoma is very genetically diverse, meaning even tumors that look similar under the microscope can have very different molecular profiles. This variability makes it difficult to find treatments that work for all patients with similar features. While molecular profiling can reveal potential targets, not every patient will benefit from the matched therapy. More research is needed to develop better predictive tools and to understand which molecular features truly influence treatment success. Another important role of prognostic factors is risk stratification. This means dividing patients into groups based on their likelihood of recurrence or poor response to treatment. High-risk patients might be offered more aggressive or experimental therapies, while those with a better prognosis could avoid unnecessary side effects from overtreatment. This process requires collaboration among specialists like pathologists, geneticists, and oncologists to interpret complex data and make informed decisions. It's important to remember that most personalized medicine strategies for osteosarcoma are still in the research or early clinical trial stages. Standard treatments like surgery and chemotherapy remain the mainstay of care. Any decision to pursue targeted therapies should be made after careful consultation with a healthcare team experienced in osteosarcoma. Patients and families should understand that not all molecular findings will lead to effective treatments yet, and participating in clinical trials can be a valuable way to access new options. In summary, prognostic factors, both traditional and molecular, are vital to advancing personalized medicine in osteosarcoma. They help predict how the disease will behave, guide treatment choices, and identify patients who might benefit from innovative therapies. While there are still hurdles to overcome, ongoing research continues to bring hope for more precise and effective care. For now, combining established treatments with emerging molecular insights offers the best path forward for patients facing this challenging bone cancer. Always consult with medical professionals to determine the most appropriate approach for each individual case.